Good morning, everyone. It's Friday. Perfect day, perfect weather out there today. And I have a very special guest, Stephanie Johnson. She is one of Acapella's, our top care managers. She does a wonderful job for us. And today is Friday. It's a big day for discharges from the hospital home and from rehabs to the hospital home. It's really one of our busiest days of the week. And so I wanted to talk about just what families need to expect and how we can help with that transition going from hospital home. And Stephanie, tell me why you like to be in private duty first, and what kind of brought you into private duty nursing.
Well, I've always been actually in the healthcare industry. It started out even when I was in high school, and I was like a little dental assistant. So I think I just have a compassion and a passion for helping others, and there's no better field to be in, especially with the clients that we get to deal with, where every day you get to make a difference in somebody else's life.
And it's true, and every day we make a difference, but every single day there is a new situation that we've never dealt with before. It's just every day is an adventure at Acappella In-Home Care.
It's always unique. Every client has their own story, dealing with their own challenges, and so that's what makes it also exciting for me, because there's no day is the same. Not one day.
It's not. You never know. So I know we got a call today, and so we're going out to a hospital to meet with a family. Tell me the questions the family asked, and let's talk about that case today.
Right. So, and you're right. It's Friday. We always kind of call it Crazy Friday, and so you get prepared for it, but it also is really exciting. So part of this is just us trying to assess what is the situation, because people on the phone sometimes don't know how to even relay what the needs are of their loved one, and you're just trying to help guide them through this process. So we're going to go out there today. A gentleman, it's his wife, who they're hoping will be discharged. I always say when you're dealing with discharge, it's a target that you're trying to hit, which is a moving puzzle, and all the pieces keep moving. So, but we're going to go out there and assess, because this individual has some type of a ruptured bowel with a PICC line. They're not sure, is she going to go home with a PICC line or not? Is she going to have an IV or not? So we want to be prepared when she goes home. And if we're dealing with PICC lines or anything that has to do with, giving an injection, that's going to be a nurse. Mm-hmm. And so we're going to want to be talking to the family and possibly the discharge nurse to know what is this individual going to need when we go home. And we just want to provide safety and comfort and care when they get there, because it's overwhelming.
It is.
He's totally overwhelmed when you're talking to him. So we're just going to guide him through the process.
And especially on a Friday. So even if a client had the option, you can go home with private duty, or you can go to a community, a facility, go to a rehab hospital. Well, even at the rehabs, they don't do any of the actual rehab, the physical therapy, speech therapy. They don't do it on the weekends. And most people don't want to go to a rehab. They prefer to go home. So what we do in this kind of situation, when it is more than just a sitter, we always have a nurse go to the evaluation, just to assess what's going on and what are the needs. If there are IVs, of course a nurse has to handle that. But one thing too, people ask the question, well, doesn't Medicare pay for this when I get home? I'm going to want home health when I get home. But Medicare, sometimes the home health has 48 to 72 hours to actually go out and do their assessment. So that leaves that Friday, that patient may not be seen by an outside professional until Monday. which leaves a family hanging over the weekend, the client hanging. And so that's why, we're so busy and we take on these clients. Once they get their Medicare evaluation, it may be they have a routine with a Medicare agency that's going to come out once a week, but we can't determine, the hospital discharge planner can't determine the amount of days or times. And so it is a puzzle. But we're here to help into that transition. And one thing I tell clients is, if you go home, you're going to need a nurse, from what I can tell, for the weekend, but let's reassess once your Medicare agency comes out, and there may be something that we can do to be able to switch to a caregiver or,
Right. And I think that's what is such a great value and benefit of the services that we provide, because we can manage the whole scope of care. I mean, I've had a client who should have probably gone to rehab but refused. She wanted to go home and she wanted to be with her dog. I mean, that was it. She was not going to go to rehab, and her doctor said, well, you're not going to discharge from here unless you have a private duty nurse at home that can manage the situation. And to be frank, we didn't even know how well she was going to do at home. She was very sick, but we were able to do nurse assessment. We had nursing care put in round the clock. And after a few days and being in her own home, and then home health coming in and doing what they needed to do and us partnering with them, soon we dropped down that care to maybe she just needed the nurses during the night. And then we went to, LVN care. And then, 3 or 4 weeks down this path, we're now she just needs caregiving services with a nurse coming in once a week to manage her medicines. Mm-hmm. And the best call was when her friend called and said, Miss so-and-so is at the mall shopping with her housekeeper. I think we're doing really well. So, you just don't know every situation, but it is so critical to have someone guiding you and managing that continuum of care. And that's what we can do, especially when we have, our nurses involved, and we have 5 great nurses always available too.
Mm-hmm. And not everybody can afford private duty, but those that can, what I always say is, this is that catastrophic time that you've saved for. And it's better to have a little cushion in there, get the care you need, rather than going back and forth to the hospital. And we have an example of another client who did not want to spend the money on care, and she has probably been in the hospital the last 6 months. She's probably been home 3 days at a time. Because she does not want to spend the money. And so she goes from hospital to rehab to hospital to rehab. And that's got to be just horrible,
Well, it's exhausting. And if you have family involved, then they're distraught. I mean, they're seeing their loved one going back and forth, not ever really making any progress. Whereas if you would just, like you said, use those resources you've saved for all your life, it's your health. Mm-hmm. I mean, just a few days, weeks, having a nurse in there, caregivers in there, making sure you're taking the medicines at the right time, you're not falling, you're not relapsing, you're eating when you're supposed to, you're remembering to even drink your water. That makes all the difference to where you get over that hump, where then you will not be going back with all these readmissions that you're having to keep dealing with.
I know. And just, we're there not only for the medicine, but we're there just for making sure, like you say, encouraging fluids, or making sure they're eating. When you don't feel good, you don't feel like getting up and cooking a meal. And just having somebody making sure you're getting the meals, making sure that the house is tidy and linens are changed or towels are washed, or, just making sure you're getting your meds at the right time. There are all those things that just a little bit of extra care can make all the difference in the recovery process.
It can. I mean, I just heard a physician talk last week about the impact, especially on the elderly, of dehydration, mm-hmm. and the impact that has on the health. Mm-hmm. And I don't think we all realize how much that actually impacts the cells, the healing, everything. And when that gets off, everything gets thrown. So, I mean, just spending a little bit of money to make sure someone's being hydrated all day, and I mean, can make a huge difference. And you forget, you don't feel good, you don't want to get up, you don't want to get a drink. But if someone's there that's willing to remind you and give you fresh, cold water, I mean, that's nice. That's a nice benefit.
Okay, I put together some scenarios, and we're going to talk about these, just some actual things that have happened at Acappella with clients that we've gotten, calls we've gotten on a Friday. And so we're going to talk about those. So, Stephanie, why don't you start? And
I will, and it's funny, I'm looking at this, I'm like, yeah, we've probably done all of these on one Friday. So,
Right.
For example, we have Mrs. Smith. She's discharged from the hospital. She had a nasty fall. She broke her shoulder. She had shoulder repair. She's had eye surgery to repair her torn retina, and she even needs morphine for her pain. So, family's overwhelmed. They don't know exactly what their next step is. They want us to take our mom home. What do we do?
Well, and that's a good example. This actually happened on a Friday morning. The mom fell at 6 in the morning. 7 p.m. She had the shoulder repair, had a torn retina, had surgery on her eye, was in so much pain. She had to have the morphine, and they were just going to have the daughter deal with it. It was an outpatient surgery is what they considered.
Oh, my goodness.
And she was 88, had some history of depression, and the children were like, we can't do this. So we wound up getting a nurse out. We did an assessment. For the next 3 weeks, we had nurses with her around the clock. And then we got her pain managed, under control. And then after 3 weeks, we had a med schedule, and we did switch to caregiving. But she was in a situation, she had to have a nurse there. If the daughters could not handle, and it is scary giving morphine. Everybody thinks, oh my gosh, I'm going to get addicted to morphine. Morphine, when it's needed, you can't get addicted. You only get addicted if you don't need it. So, and you take it because you like that feeling that it gives you. But if it is truly for pain, you can't get addicted to the morphine. So that's an example of a true thing that happened, and we were there, and it was a win-win scenario.
Well, and you see, when all of that starts coming and putting in place, you see immediately the relief on the daughter's face. Like, okay, I can do this because I am not alone. Someone else is going to help me manage this whole process. And then I know they're thinking, as I would be thinking it too, especially if we're doing round the clock and you have morphine involved, she's going to get to go to sleep. I mean, so much of this is exhaustion on the caregiver's part, that's the family, and them not being able to function during the day when they probably want to be there more for their loved one. They just want to sleep.
They're
and
exhausted.
We can be there at night saying, look, we've got a nurse here. We're going to manage all these medications. She needs something, we've got it. You're good. Go to bed. And that in itself is healing to the family, because now they're thinking, okay, I can actually function. So anyway, another situation we've had, I think, even on a Friday, is we had a 26-year-old in a car accident, broke both of his wrists. He can't feed himself. He can't actually wipe himself or even use like a urinal. So what does he need?
Okay, that's an example. This is something happened. This sweet little guy was in a brand new car, got in a wreck like an hour after he bought it. And so very wealthy individual, but he had to have somebody with him. He did not need a nurse. He was alert. He was oriented. He was able to say, I need a pain pill. So as long as they can make the decisions and not have somebody make judgment decisions, they can have a caregiver as long as he can make those decisions. So we did have a caregiver. If he needed a pain pill, we could give it. The caregiver could get it to him and put it in his mouth. But that he had to have, until the casts were taken off, he had to have private caregiving around the clock, because he couldn't do anything. He couldn't feed himself. He couldn't wipe himself. He couldn't bathe himself, brush his teeth. I mean, we
All
had
the
to do
things you
everything.
think you don't, one hand is one thing, two hands, I mean, you can't even open a water bottle
And
to get a
I
drink.
know he said, I never realized how important my limbs are until this happened. And he wound up having caregivers, I think it was like 3.5 months, doing fine after, and very appreciative of our care. So we were actually the hands for this gentleman, and it wound up being he healed. He's doing great now.
Right. And plus, I mean, even in that situation too, I mean, he can't even drive to his own doctor's appointments or to his therapies. And so that's just a whole nother need that we get to fulfill too. And that's not even in the home, is just making sure they're getting to all their doctor's appointments, because I guess none of us want to see a gentleman with 2 broken wrists driving on LBJ.
Right. Okay.
All right. So here's one too that we have had. So a patient is on 26 medication, and her son worries that she is getting very confused managing all of this with the amounts and the times.
Okay, and that is a good one, because we have this a lot. We have so many internal medicine doctors will refer say somebody's in the hospital and they'll get a list of meds that they're supposed to take. They're sent to their internal medicine doctor, who sends them to a specialist. And this is an example. This patient had kidney problems. She had heart problems. She had lung problems. So she had 3 different specialists. And some medicines were old. They had been DC'd. She was confused on what she was supposed to take, what she wasn't take. And it wound up putting her in the hospital. She did get very dehydrated. And the doctors in the hospital felt it was because of all the medicine she was taking unnecessarily. So this particular case would be, we would have a nurse go out and evaluate, call the doctors. It might take a week or so at home to get her meds under control, maybe even a daily nurse visit. How are you doing? How's your blood pressure? How are you drinking? How are you eating? Because medicines you take can cause, if you're not taking the right thing at the right time, stomach upset, can cause, we've had examples where patients have been on 2 different diuretics, and their electrolytes get depleted, just because one doctor doesn't know the other one has prescribed. And this patient might get one from a pharmacy service, and then another from a CVS. And so somebody does need to oversee what they're taking. And once we can get those meds figured out and in order, then we can set up a pill box and go out once a week or once a month. So that would start with a little more aggressive nursing care, and that it could ease out into a caregiver just set up a pill box.
Right. Well, this is so common, not even 26 medications. Beyond 10, and you get sick and you run to the urgent care. And then they prescribe something, not even knowing what the other 10 are. But, if you look at the side effects of most medications on the bottle, it'll say, do not operate don't drive a car, because it's going to make you droggy or foggy. So you're taking meds that don't make you think clearly, and you're supposed to remember to how you're supposed to take the other meds at a certain time. So once those meds do get, managed on a schedule, it's so great for a caregiver then to be there saying, okay, remember, now it's 1 o'clock, now it's 3 o'clock, because some of the things you take, they really do impact your cognitive abilities. So you don't want those meds to get off track.
Well, and if somebody does have a little dementia or short-term memory, they may forget, or they may take their meds and say, you know what, I think I need to take them again because I don't remember if I took them or not. That's why having meds set up in a pill box, having a nurse overseeing, just to be able to communicate with the doctor, you know what, she's taking her meds in the morning, but she doesn't take them at night. She forgets at night. So can we go ahead and move some of these meds to the AM time? Another example, we had a patient just last week who discharged from the hospital. On her discharge paperwork, she was told to take 2 antibiotics for 11 days. The nurse instructed our caregiver to make sure she took her medicine for 14 days. When we got to the pharmacy, there were only 3 days worth of one antibiotic on the prescription. So it was very confusing. And and the patient was in the hospital for an infection. So you want to make sure you're taking this correctly. So it was 2 or 3 calls to find out exactly what we needed to do, and we got the patient on the right track. But that's where working with a company that does have nursing providing
Definitely.
too makes a difference, and it's going to keep that patient out of the hospital, because if she doesn't take it correctly, that infection is going to come back, which is going to go back into that vicious cycle. So that's an example there. What
Right,
else?
and it's unrealistic to expect a child who's taking care of their parent, who's working full time, to be trying to be going to a pharmacy, figuring out what does she take and what is she supposed to. Oh, they didn't do this right. So we do get to once again provide that relief. That's the part I love about this job is you are helping this client that needs you, but to see the impact on the family is totally just, I don't know, it's like the bonus of all of it. They're just so thankful and appreciative. They become my friends. I mean, not only the client, but the family members, because they have such an appreciation for the services that we're able to provide. All right, so Joe, a patient, one of ours, had surgery on his back. He has a dressing that has to be done every day. It's easy. That's what, the nurse is going to say at the hospital, or, the surgeon when he gets home. It's easy. You can manage this. And he says, well, what do I really need? I mean, he can't even reach it.
And so he can't reach it. He can't see what's going on. That, I would say, he'd need, if he's by himself, doesn't have family, he's got to have a nurse do it. We can't have a caregiver do wound care. That you want to look for signs of infection. Is it warm to touch? What do we need to apply to the wound? So we do have to have orders for that. It's not always easy, especially if it's something the gentleman can't even reach. But just with the busyness of the hospital staff, the discharge planners, getting home, sometimes the simplest things, like, for instance, a wound, they don't think, how is this guy living by himself going to be able to do that? All they're thinking about is, we got to get him home. He has been in the hospital for 3 days. He's got a discharge on Friday. He's alert and oriented. He says he can handle this. But a lot of times it does take that extra set of eyes to say, wait a second. If he can't change that dressing, it's going to wind up getting infected. Or so just having those eyes and ears and help from us is going to be beneficial for his healing.
Well, this happened Monday morning. We got the call at 6:30 in the morning from a very concerned mother who lived way out of state, and her son the night before had a motorcycle accident, and he's home alone. He got discharged. His back is all torn up. She doesn't know what it looks like. He can't tell her what it looks like, and they're trying to get here 16 hours away, and he's home alone and has been home alone since he got home that night. So we were able to send over a nurse, do an assessment, see what we could do. She helped give him a shower. She went and got the stuff to clean the wound because it's all in his back, got him all comfortable. And then we sent a caregiver to help him through the rest of the day until family could come in. So he wasn't by himself, and we were able to do some, not only just get him something to eat, go run an errand for him, but just make sure he was safe and comfortable. But in the beginning, we needed that nurse there because they just sent him home with this thing on his back from the accident, and so he needed a shower.
Well, and that's the thing when they're discharging from the hospital too. They don't think about, do you have food in the house? Do you have water bottles? Do you have somebody that can go pick up your medication? I mean, that guy was really stuck.
Yeah, he was stuck. We had to go do all that. We had to go get the supplies that he needed. I mean, some 22-year-old gentlemen don't have all these ACE bandages and Neosporin in their
just
medicine.
Calling a buddy too.
Yeah, and they're not going to have.
You checked my back.
Probably not going to happen.
Right.
So was great because we got that call at 6:30 in the morning, and we did have a nurse there by 10 o'clock helping him and stayed with him for a couple hours, and then we just had a caregiver come for the rest of the day.
Well, we just have a few more minutes, but I want to talk about nurse delegation too. That's a subject that a lot of people are confused about. There are very few companies that will offer the RN delegation, and we do. So let's talk about that. I know we have a couple of clients right now that get RN delegation, and what are some of the things that we can delegate as nurses?
Well, there are just specific things that can be delegated as a nurse, and obviously that's going to be determined by a nurse. So, because with nurse delegation, that's their license that has said, I choose to oversee this individual that's going to provide care for this family, for this patient. And sometimes it's because it makes sense. It just makes sense. It's an easier task that can be done. But when it comes to nurse delegation, there are very few agencies that will do it because it is a very much managed process. You can't just be having a caregiver out there doing nursing tasks that are not being overseen by a nurse.
Right. And if there's a situation, and this is what I try to explain to families, if a patient has a G tube, for instance, and we have delegated that the caregiver can do G-tube feeding and help with that. And that's a tube in the stomach to feed if they've got a throat problem or with something, swallowing difficulty. But an RN has to oversee, and if there's a problem, let's say Saturday morning at 2 in the morning, and there's a problem with the pump, an RN is going to have to go out. So for RN delegation, it's got to be stable and simple, stable care. It might be a little trickier, like G-tube. There are things that you want to look for. You don't want him to want to make sure he's digesting the food. You don't want him to choke. There are ways to, with a feeding tube, when you're
flush it,
give water. There are a lot of things you want to do, and you can't just, hey, go home, here you go. You can do that. There is oversight that goes on, and we work hard to make sure that is a stable and simple condition going on.
Right, because, you think, feeding tube, that's not that. You just give them the food. But, 2 weeks down the road, they were taking 6 cans, now they're taking 4. Now we're at a very slow rate of giving it to them, but because he's doing so well, we can make that rate go a little bit faster. So instead of it taking 8 hours to feed, you might get it down to 6, depending on the situation. But it's going to be that nurse's responsibility to be in touch with the doctor, getting the changes in those orders. So it is a great benefit to the family because, let's be honest, it is cheaper to have a caregiver in there than a nurse. I mean, obviously there's nurse delegation fees that are involved, but especially on an ongoing case, it can be cost effective, but the nurse really does have to be completely involved in knowing what is going on with that patient, because if his condition changes, if what he's supposed to be taking changes, that all has to be received from the doctors, documented, and then they have to make sure that the caregiver knows all of those different arrangements.
And if somebody has a question about RN delegation, what can they do?
If there's a question about nurse delegation, and when I get that, to be honest, I always say a nurse has to talk about nursing things. So I'm not a nurse, so I will always try to answer as many questions as I can, especially how the process works. But as far as determining, can it happen? Can we set this up? What's that going to look like? Making that type of medical assessment, then we would always have our director of nursing be involved, or you, and make those choices, and then just see. And then you have to have a nurse that is willing and available to be there for the training and to oversee that.
Right.
And then the second piece is you have to have a caregiver that is comfortable and, wanting to perform those types of tasks. And thankfully, we do have caregivers that have been trained, like on a feeding tube or some of those other things that can be nurse delegated. But it is just it is a scope of things that they can do, and you want to make sure they're comfortable doing them.
Right. And that, we have, sometimes we have people on hospice and they're getting morphine or they're getting lorazepam. And so we can delegate that too, as long as it's scheduled, and so they don't have to have a nurse for certain things. As long as it's scheduled, it's still delegated by a nurse. So a nurse is overseeing that. But anyway, today's been great. If you have a loved one that is being discharged or you have questions, you can always call Acappella, speak with me, speak with someone like Stephanie. We are here to help, and just want that transition home to go very smoothly. And
Yeah, we just want to be there to offer you the support you need and your loved one needs to, get them home comfortably, but mostly safely, and help you. You're not alone. That's what I always tell people. You don't have to be doing this alone.
So thank you so much. Have a great day.
Thank you.
Call us if we can help you.
Thank you, Joe.
Thank you. You did great.